Hello and welcome to Health Matters on Channels Television. Thanks for joining us. I am Mary Alale Yusuf. Globally, the number of confirmed cases of COVID-19 as at October the 23rd was over 42 million. There were more than 28.5 million recoveries and more than 1.1 million deaths. France, Argentina, and Spain now have over 1 million cases each, which was in the case last week. In Nigeria, there were a total of 61,882 infections, out of which 57,190 have recovered and 1,129 have died. Recovery rate is about 92%. Case fatality rate is 1.8%, and 602,239 samples have been tested. That's more than 29,500 samples since the previous week. In the midst of 2 weeks of NSAS protests across the country by thousands of youths, reports of 181 confirmed cases of COVID-19 in a private boarding school in Lagos also made the news. What could be the fallout of these occurrences, and how must the situation be managed? My guest is Head of Risk Communications at the Nigeria Center for Disease Control, Dr. Yahya Disu. He joins us from our Abuja studio. Thanks for coming, Dr. Disu.
Thank you. Good afternoon, Mary.
You're welcome. I must say, I'm a bit surprised that you got up to 29,000 plus samples in there in 1 week, in that troubled week. How did you achieve that? That's like 5,000 more samples than last week.
We've never relented in terms of the drive for creating demand for tests for sampling, for people to come and do tests. And we've been reviewing our strategies, working with the states to ensure that they expand the testing sites, sample collection sites, to different local governments. Some states have been responding, even though some states are still trying to see how they can improve their sampling collection sites. And then also awareness creation is ongoing. Right now, Nigeria Center for Disease Control also have technical assistants they have sent to the states to work with them to see how they can best optimize the disbursement of the 100 million naira to each state. And that is being utilized to ensure that people come out to do the test. But we still need more people to come out, especially with regards to the recent events in the country where you have mass gathering in various states, which means that the virus must have been exchanged. And this is between or among youths that are known to maybe carrying this virus, but they may not be showing the symptoms. And
okay, we'll get to that in a minute.
There is this risk.
We'll get to that in a minute, but I really want to tinker with these figures first. I noticed that the recovery rate increased. Last week it was 85%. This week it's 92%. What do you make of those numbers? Can you explain that?
And actually, you will remember that these figures started changing in early August because initially, the figures we capture as people that have recovered were people we discharged from our treatment centers. Meanwhile, there are still a large number of people who had mild cases and that were managed at home. And then we revised our guidelines with regards to the discharge and how we can record them. So the states, Lagos State started then. And they look backward and look at those cases that were managed at home, that are no longer symptomatic, that have been discharged in principle because they were managed at home, they've exceeded the incubation period. So they began to upload those cases. They report them to NCDC. So we also advise other states to start doing that. And different states, as they are ready, they finalize their records, and then they communicate to us, and we continue to report them. Then that means if the case fatality rate is less than 2%, it therefore means that we should even expect a more recovery, higher recovery rates by the time we get all our data and facts straight.
Okay, so let's now go to the NSAS protest that took place over the past 2 weeks. You know, people closely packed together, screaming on top of each other, you know. What do you see as the COVID-19 picture in the coming weeks in Nigeria?
Anyway, I won't be surprised if you have a spike because the situation that increased the risk of transmission, we've already experienced it, the mass gathering. And then, you know, when people are protesting, they demonstrate anger, and then when they are hungry, they disregard all the protocols. And they don't even believe what they are doing is wrong, and they even feel that they are not at risk, especially their youths, and this is a misconception. So because of this misconception, they feel even if they get this disease, they are not likely going to come down with it or with its severity. Because of that, they have false confidence of taking the risk to make sure that they mingle with each other. You know, during mass gathering, during protests, people come from different places. People from high-risk area mingle with people from low-risk area, and then they begin to exchange this virus. The major challenge now is when they go back home to their parents, to their loved ones, people who are older than them, who are at risk of coming down with the illness or showing a severity, and then they begin to spread it to their loved ones. So my message would be that people should be very, very, very careful, especially when they go back home, those who have been on the street, and then where they even live, they ensure that they observe this social distancing, they use their face mask, and then if people see that there are people who are symptomatic, this is a time for them to quickly report themselves in the hospital. My message is essentially for three categories of people. First, the general public, that they should be aware of this risk, and the COVID-19 is still with us. It has not gone, even though people are agitating, but their life is still important. So they need to observe the protocols. Then the second category of people are the healthcare workers, healthcare providers, and all other people who are on the field doing COVID-19 response. And they should not lose their guard, and then they should make sure that they heighten their index of suspicion, and then their infection prevention and control techniques measures should be properly complied with so that they don't get this disease and it will encourage transmission in the hospital. Then the public health authorities and policymakers, we need to also let them know that they need to continue the sustained efforts, the campaign, the resources they deploy to ensure containment of this disease in our community. And then awareness should be created for people who show symptoms to go to treatment and sample collection sites so that their samples can be collected. And the toll numbers are there, the helplines for the states. Many states have those numbers. They should find out and call them. And if you go to NCDC website, these sampling collection sites are also announced. They are also on the website, especially where we have the laboratories. So we have no reason to say that we can't get ourselves tested because we have over 100 laboratories in our network testing this COVID-19.
Yes, I noticed that the map of labs all around Nigeria has just turned green. There's a lab everywhere now, so no excuse. But let's talk about the school. A student fell ill, right, and was sent home to recover. After 3 days, she tested positive for COVID-19. With hindsight, do you think that was the best option? Should she have remained in school?
Anyway, I must first commend the authorities of that school for even sending such a person home early, at the same time alerting the health authorities. And then for the state government to have responded, for them to be able to identify those who are ill and those who were in contact with this person, and they're able to collect their samples to get them tested. And that is where we're able to understand the magnitude of the problem. If they had not reported this, and then that means the disease will continue to spread. More importantly, it has also created awareness about how every other school needs to be sensitive, and this is no joke. Before, people used to say that children are immune, they are not prone to this disease, but we have seen the evidence in the school that reported these cases. It also shows that our surveillance system is working, but this is a time we need multi-sectoral collaboration, because in school setting, you need Ministry of Education who has authorities over the school, but the Ministry of Health has authority over the health and responding to health situation anywhere, whether in school or outside school. And then Ministry of Environment, they also have roles to play when it comes to environment, ensuring that wash facilities are functional, and then waste management, how they separate the waste, and how they manage the waste, how they dispose the waste in such a way that it doesn't constitute a risk or threat to the community. So
Speaking,
we still
let me
have a
cut
lot
in
to
there.
do, because I'm not sure any school...
Speaking about the environment, there was a time, just when COVID-19 started, when they took these decontaminators, should I call them, to the streets and sprayed the streets. Now that people have run around all over town in different states, do you think that they should do that again? Spray the streets with these decontaminants? Would that be the best option because of the surfaces that keep and retain the virus?
I think we now have better understanding of how this disease, how this virus is transmitted from person to person, and then what measures really work for us well. I won't really support spraying the street is the major issue here. It's a major measure that we need to take. It's more about the physical distancing, and then again, the issue of hand hygiene, and to ensure that we observe our hand hygiene frequently. Peradventure, we contaminate our hands. And then again, we wear our face mask. And that is one thing I've seen Nigerians don't do anymore. And you go into the streets, you even go into places where, like banks and then some malls, and people they disregard this protocol. Even when they want to enter a place where they ensure strict compliance, at the entrance, they wear it, but when they enter, then they remove it, they put it on their chin. And those are things that are really important for us, because we now understand how this virus moves from person to person, these through droplets, and then from place to place. So spraying the street is least of our problems. And then when it comes to environment, we are talking about waste management in schools, where they ask them to use face masks. And then, of course, since we have a number of people who may be carrying this virus that we may not know, and they are using face masks, and if they just discard the face mask carelessly, then other people can get in touch with this, and then they can get themselves contaminated. That is why with the policy has to be there that every school must have this, every institution, every organization must make sure that they abide by this, they have this policy, and they comply with them. And then monitoring should also be an integral part of what we do to ensure that people comply. And then if I have to take us back to the school, efforts we have actually made, I think many people can learn from this. And then the Federal Ministry of Education has actually led in these regards. And they brought in the stakeholders to develop guidelines, which we made input into. And this was released about 4 months ago. Beyond that, in the last few weeks, then an implementation template was developed. And this template specifies the priority areas, issue of safety protocols, issue of protection and well-being, how to quickly detect this case in school, and how to provide the appropriate care for those who are affected, and then protect others from getting it, and how to also ensure that those who, the learning too is not undermined, because that's the primary purpose for which this school is established, so that in the event of COVID-19, we don't undermine learning, just like what happened to us in the past. And then even if we are implementing protocols, we still don't undermine learning. We ensure that we implement the protocol in such a way that we still achieve our goals. So there needs to be a balance here. Then the fourth component of that is inclusiveness, to ensure that people who are vulnerable, population with special needs in school are also taken care of. We don't want a situation whereby either by implementing the protocol or by occurrence of cases in school, and these people are sidelined. Whether you are disabled, whether you have one form of special needs or the other, everybody should have access to regular learning. With that, to implement that, we need a school health team on ground that will comprise of the teacher, the students, and then that will make sure that they are well tutored in these protocols and they are able to teach, monitor the school, monitor compliance in the school. And
okay,
then carry out
Dr.
regular
Disu,
health talks, and then
I really need to stop you here.
Health institution.
I really need to pause you here. We are going on a short break. When we come back, we'll continue. Please stay with us. Welcome back. We're talking about gatherings and COVID-19. 0808-054-2233 is the number to call if you have questions about this topic. You can also tweet at CTV_Mary A while we continue with the rest of the show. Now, Dr. Disu, I want to ask you, in all honesty, do you think that if the protocols had been observed, mask wearing, social distancing, hand washing, and all that, that this incident in the school could have been avoided? 181 staff and students getting COVID-19.
Anyway, they are all risk reduction measures. And there is also a possibility that some of the students or even the staff may be carrying this virus when they resume in school. But the essence of that is for people to prevent transmission, they need to strictly observe these protocols. I believe there is a huge gap in that. There is a huge gap in that. And that might not be limited to that school alone. It's a lesson for all of us to learn. And since we now have better understanding of how this disease transmits and how we can prevent it, so why don't we use the knowledge? It was because we didn't have this knowledge before. That was why we closed down the school. Now that we now understand how this can be protected and what people need to do, there are simple measures. Wear your face mask, maintain physical distancing, wash your hands. And the schools, I believe, provide these facilities, but they need to ensure that they continue to remind these students and staff to continue to wash their hands and wear the face mask. It could actually be as a result of the fact that Nigerians generally believe that COVID-19 is no longer in Nigeria, and then that is what extends to that school. So because the school community is still part of the larger community. So
let's take this call, Dr. Disu. I want to take a call from Ayomide I think, yes, in Ojota. Ayomide, are you there? I think we lost Ayomide there. All right, let me quickly ask you, contact sports is now being allowed. There's a lot of monitoring to do. There are the schools, the markets, and now this contact sports. Are you giving your guidelines on trust, or is there going to be some sort of monitoring to make sure COVID-19 doesn't spread from there? I think this is, contact sports is also part of the reason why some countries are beginning to see higher numbers, and we don't want that to happen here. What do we do?
I think one of the things that we need to do is to learn from other countries. And to this effect, we in Nigeria, we're already thinking of implementation approach that is sector-based. And then we begin to look at sectoral approach, and then that has 4 prongs. And the essence is to make sure that sectors that share common stakeholders, common practices, common laws, and they are able to develop their own guidelines and mainstream COVID-19 into it. Through that, they will be able to own it and begin to implement risk reduction measures. And we also provide further technical support on how they can implement these guidelines. That's what we have done for Ministry of Education, Ministry of Transport, and then also the tertiary institution, we're working with them now, that is National University Commission through the Ministry of Education, and then law school, even the NYSC camp. So what we're looking at is for the Ministry of Sports too, they need to develop the guidelines, and the guidelines should be able to specify what kind of sports they can do now based on the risk level in the community, what kind of sports they can do when this risk level is reduced, and how should they do this? And so that is the guideline that we need for that before we can say, oh, they can start contact sports. But it all depends on the prevalence, the burden of the disease also in our community, and the discipline with which people are ready to comply with these protocols. Then the top prong of the implementation approach is for us to provide regular updates. As science evolves, as we get new information, we share it with sectors, and they themselves need to update their guidelines. And we continue to provide support like training for them, supportive supervision in doing this. And we provide regular key messages based on the weekly data that we analyze from the community, social media, online media, and from regular weekly opinion polls that we conduct. And these key messages are to guide various stakeholders on what to do with regards to COVID-19 prevention. The last is the feedback mechanism for us to track how they are complying with this guideline, and then again to understand how we need to provide further support to these sectors. And then the last one is the feedback we get from them, we also use it to shape our guidelines with regards to case management, with regards to surveillance, with regards to our communication strategy. So that is what we need to do. Although we are still having challenges because some of these sectors, it's not easy for them to just understand it because this is new normal, and then we continue to train, we continue to engage. One of them is the Standard Organization of Nigeria. We've done a lot, and they are looking at the tourism sector, the hotels, and they are also looking at some segment of the transport sector. They develop guidelines, and stakeholders have been brought together. We've been reviewing this, and it's at the final level of approval, whereby all stakeholders, once it's approved by Standard Council of Nigeria, all stakeholders will key into it. It guides what they do, even including creative industry. And that is the same thing that needs to happen
as we go
in the sport sector, so that we don't start having increase in the number of cases of COVID-19 because people are doing their regular business. Of course, we need to resume our livelihood, our way of life, our leisure, things we do, but in a new way while we consider implementation of the protocols.
So in 1 minute, can you quickly give residents some advice of how to go about their business, especially as schools are reopening? More and more schools reopening. Just give general advice about how to go about things.
The general advice is we all have to take responsibility at individual level, at family level, at community level, even at policy-making level, whether you're in private sector or public sector. Taking responsibility means starting from you. How do you protect yourself from getting this disease? In case you have symptoms, how do you ensure it doesn't spread to others? If you are in family, how do you ensure that your family is protected? Then, as a community, how do you work together to ensure the community is safe? Even those who have it, how do you ensure they have access to care, and then you truncate the transmission? At the policy-making level, our policymakers at all levels, federal, state, local government, and they should also continue to provide the necessary resources and then political will that is required for us to be able to achieve this goal. We should not forget that we need to wear our mask. Our mask protects you and others. And then we need to wash our hands regularly. And then we need to also ensure that we observe physical distancing. In a situation where this is a little bit difficult, we must wear our face mask and make sure that we wash our hands regularly. And then if we go with this ideology, COVID-19 stops with me. And that is extension of taking responsibility. If you can ensure that it stops with you, it means others can't get it. Then together we can all defeat this COVID-19. For those
That's
who are
a wonderful place.
Nigeria has put measures in place.
Oh, we can't continue with that. But I think COVID-19 stops with me is a marvelous place to stop the show. Thank you so much for coming to the show. We really do appreciate all the advice.
You're welcome.
COVID-19 stops with me. Please let COVID-19 stop with you. Have a wonderful day. I am Mary Alale Yusuf.